It's all for one end goal, and it's the patient. Making sure that we deliver on time, we deliver the quality, so that the patients who depend on our therapies get the therapies that they deserve and that they need. So I would just encourage you to keep that in mind throughout the day and really engage in the process and try and relate it back to what you do on a daily basis.
I'm here to give you a bit of a perspective, reaching back, into R&D and development, and see a little bit of a glimpse of what gets the product ultimately into the plant and closer to the patient.
I guess you always think, why does this happen to me? I come from quite a large family, and I would be the first of my generation to suffer from cancer. And the consultants just say it happens. At this stage, they don't actually understand how Hodgkin's lymphoma comes about. But it is there's a lot of questions. Why me? But you just have to live with that and accept it and move on.
The focus for the company is to transform the life of people or patients with cancer. And that can never be forgotten during our daily life, not just from us who work on the clinical side, but for you who have a scope to your daily work and to reach out to the patients.
It's amazing when you're faced with cancer, how your priorities change. And if it was ever about the size of the house or the way the house was or the reg number on the car, it's amazing how it's not important anymore. It's about the little things in life. It's about our families, the people we love, our friends, the people we work with. These are the important things.
It's good on a personal level in that it brings you down to earth and brings you back to what we're doing is for patients. We're making medicines here, and you go about your day-to-day job and you sometimes forget why you're doing it, and what's at the end of it all is our patients. So it was good that it brought that back home, and it'd be nice for everyone to be able to be brought back down to that level at some stage over the course of a year or two, to feel that and to feel why we're doing it, and especially for something as serious as cancer.
I think everybody knows somebody who's had cancer and has had to deal with it and is aware of all the conditions and all the elements of the illness that there are. But one thing that you don't realise is the responsibility to take a huge amount of medication, which are dealing with a whole raft of different types of conditions that are as a result of the illness itself.
Since March 2013, I have had 14 operations, 14 general anaesthetics and 17 infections needing intravenous antibiotics. I've been plagued by infection. I've become well known on St Michael's ward in UHG and have been blessed by the care and compassion of the nursing and care staff and all the surgical teams involved in my care.
We're moving to an era where the risk-benefit ratio is shifting, where we can use treatments that will have less acute side effects, but also as importantly, less chronic side effects, ultimately allowing patients to have a better quality of life. But also this is increasingly associated with improved disease control and overall survival. Complex biologics, small molecule inhibitors and cellular therapies will, in my view, completely replace the need for chemotherapy in the future. We're not there yet, unfortunately, but we are getting there.